Welcome to this video on understanding food intolerance. Presented by Dr. Umesh Bhargava of the Walnut Healthcare Global System, we will explore how state-of-the-art clinical intelligence can be integrated with compassionate care to improve patient outcomes worldwide. Food intolerance, or food sensitivity, is a common digestive issue occurring when your body struggles to break down certain foods. Unlike allergies, it does not involve the immune system and is not life-threatening, though it can significantly disrupt your daily comfort. This video serves as a patient guide to food intolerance. We will cover the nature of the condition, necessary nutrition care to manage symptoms like gas and diarrhea, and essential topics including diagnoses, management plans, and the clinical outlook. To understand food intolerance, we look at three pillars: the reaction, which is a common non-immune response, symptoms, which affect your quality of life, and management, which requires identifying trigger foods, often with the guidance of a professional dietitian. There are several common types of food intolerance, including lactose, histamine, and gluten intolerance. Others involve sensitivities to FODMAPs, fructose, or common food additives and chemicals, which can cause significant digestive discomfort. Various factors can cause these intolerances. These include enzyme deficiencies, such as missing lactase for dairy digestion, chemical sensitivities to substances like caffeine, reactions to food additives, or underlying digestive conditions like inflammatory bowel disease. Beyond specific causes, several risk factors can contribute to developing intolerances. These include imbalances in the gut microbiome, advancing age, the use of certain medications, and specific eating patterns that favor hard-to-digest foods. Untreated food intolerance can lead to several complications. These may include missing essential nutrients by avoiding food groups, the persistence of digestive symptoms affecting daily life, and even unintended weight loss if dietary plans become too restrictive. Diagnosis involves a careful look at your history. While there is no single test, doctors often use food diaries to track symptoms, elimination diets to isolate triggers, breath tests, and general checkups to rule out other medical conditions. Management and treatment focus on symptom control and avoiding triggers. This is typically achieved through dietary changes with a dietitian, the use of over-the-counter medicines, enzyme supplements, and ongoing tracking to adjust your diet as needed. To maintain dietary balance, ensure you consume a wide variety of healthy foods. Control exposure by reading labels and staying vigilant. Always consult with a certified healthcare provider before making major changes to your eating habits. See a provider immediately if you experience red flag symptoms like severe pain, persistent diarrhea, or rapid weight loss. Use your appointments to discuss specific food triggers and potential risks for nutrient deficiencies. The outlook for most people is positive. While some intolerances last a lifetime, symptoms are manageable. With proper guidance and dietary adjustments, you can enjoy a high quality of life and fully participate in social activities. In summary, remember that there is no single lab test for food sensitivities. Identifying them requires a systematic approach of tracking and elimination, which remains the gold standard for finding relief and maintaining a healthy, balanced lifestyle. Finally, to identify the specific food causing your reactions, keep a detailed log, systematically remove suspected items to let your system stabilize, and then reintroduce them one at a time to observe your body's response. Let's look at a step-by-step method to identify your trigger foods. The first phase is to keep a detailed food and symptom diary for 2 weeks, recording everything you eat, the time of eating, any symptoms, and the severity. Maintaining this log helps you spot patterns and narrow down potential suspects. Remember to track your symptoms, like bloating, headaches, or fatigue, along with the specific timing to understand your body's unique response. Next, identify common suspects. Based on clinical data, frequent triggers often include dairy and gluten, FODMAPs and histamines found in foods like aged cheese and wine, or various food additives. Proceed to an elimination diet for 2 to 4 weeks. Remove one category at a time, such as dairy. If symptoms improve, that category is a likely suspect. If not, move to the next category. This structured elimination process is considered the gold standard for identifying clinical food sensitivities. After the elimination phase, enter the challenge phase to reintroduce foods slowly. Add back one food at a time, eating a small amount initially, and waiting 24 to 72 hours before trying anything else. During reintroduction, closely monitor for any physical symptoms or delayed reactions to isolate your specific triggers. Once you have tested a food, evaluate the results. If symptoms return, you have found a trigger. If symptoms do not return, that food is likely safe to gradually reincorporate into your diet. Keep in mind the crucial observation rule. Sensitivities often cause delayed reactions, so monitor your body closely for up to 72 hours after testing a food. While food sensitivities often lack reliable lab tests, some specific intolerances can be investigated through clinical diagnostics, like hydrogen breath tests for lactose or fructose, or blood panels for celiac disease. These clinical diagnostics are essential to rule out more serious medical conditions before proceeding with general dietary exclusion plans. Always seek professional guidance. Work with a clinician or dietitian, especially if symptoms are severe, to avoid nutrient deficiencies and ensure any elimination protocol is managed safely. Professional guidance provides nutrient protection and ensures that you do not restrict essential foods longer than necessary during your assessment. Remember that food sensitivities often cause delayed symptoms, produce non-specific issues like fatigue, and frequently do not show up on traditional allergy tests, making structured observation vital. Finally, avoid relying on unvalidated online blood tests for food sensitivities, as they often lack clinical oversight. Rely on structured, proven methods instead. When should you involve a clinician in your journey? It is important to seek professional support if your symptoms are severe or worsening, if you have chronic gastrointestinal issues, or if you are facing nutritional concerns like weight loss or anemia. Additionally, consult a clinician if you suspect specific conditions such as celiac disease or IBS, or if you require a tailored, personalized nutrition plan based on your unique medical history and laboratory findings.